What graphene oxide and nanotechnology have to do with 5G. An interview with biostatistician Ricardo Delgado Martin.
Vale, pues empezamos.
Okay, let's get started. Welcome, Ricardo Delgado Martin. A short introduction of yourself for the German-speaking audience. Well, Ricardo Delgado Martin is founder and director of La Quinta Columna, the fifth column. He has a degree in biostatistics from the University of Seville. He has a master in biostatistics, postgraduate in health biology, clinical microbiology, epidemiology, and clinical immunology, applied at the European University of Miguel de Cervantes. University expert in clinical genetics from the University Antonio de Nebrija, certificate of scientific contribution from the University of Seville, and postgraduate master in child psychology, master in banking and finance from the Higher Institute of Banking Techniques and Practices, master in personal training, in other words, a long and extensive dossier.
Bienvenido, Ricardo.
Gracias, Ángel.
Thank you, Ángel, for the invitation, and to the KLA TV channel for the opportunity to present our research there.
Okay, and from there, from those people who had the second or third dose that they call the booster, they may develop a pathology that they call long COVID. It seems to mean persistent COVID, right? Or something like that.
But that's it from the biological point of view. We did not know of a biological agent that was persistent. I mean, the common flu that will be any other type of coronavirus, as they say. Although the graphene oxide generates the corona effect, they probably got the name from there. They said, let's say it's a coronavirus. Any other coronavirus, it either terminates the life of the host or the host develops immunity to it, period. It doesn't have lifelong sequelae. What does have lifelong sequelae is radiation. And it's a syndrome. It becomes a chronic irradiation syndrome, which has been in the medical scientific literature for over 70 years. This is not new.
Okay, so for example, with the same family, there may be members maybe who have developed that long COVID, or even the COVID, let's say, to call it in a more general way, and others maybe who haven't found out. I guess, I don't know. That is a matter where it happens, and
sure, it depends on the radiation that you absorb, and then it also depends on intrinsic variables of the individual himself, such as glutathione levels. Glutathione is an antioxidant that works precisely against graphene oxide because it generates free radicals. So if it generates free radicals, what it will do is oxidize all kinds of molecules, causing their death. And on the other hand, endogenous glutathione. That's why NAC works against COVID, because it's a precursor of glutathione, or vitamin D. That's why COVID patients have low levels of vitamin D, because they exhaust their resources trying to degrade the action of graphene oxide. That's why people who are vaccinated, or those who actually have COVID, are so tired, because the body, the immune system, is constantly working trying to degrade the action of the toxicant. So glutathione in young individuals, much glutathione, not so much aging, more difficulty to actually have COVID-19. From the age of 65 onwards, the glutathione levels plummet. That is why it affected, because now it affects young people as well, from the moment young people are being vaccinated.